Good morning, everyone. Today, I'm going to talk about as something that I've been getting a lot of, or I've been hearing a lot of it from my clients that I've been talking to lately, either on their follow-ups or either on their breakthrough calls or either on their consultations. And I've been hearing lately a lot of patients talking about it, or clients of mine talking about it. Something they're referring it as to normal diabetes. Now, I'm just trying to think to myself, what is normal diabetes? So if you like this video, please share, comment, like, if it makes sense to you. So please share it, definitely comment on it, definitely hit a like button, show us some love. So I'm going to be talking about what is normal diabetes. I mean, in my eye, what is normal diabetes? I mean, I don't know what normal diabetes is. But when I ask my clients, like, what do you mean by normal diabetes? And what they've been telling me is they were diagnosed with diabetes. Now they went to their doctor, and when they got diagnosed with diabetes, they give them, let's say, metformin or some of the drug medications that are helping them lower blood sugar levels. Now they go for their follow-up after 6 months, and they do another test, and their blood sugars are normal, or they've been maintaining it. But they're still taking the medication, but their doctor has been referring them as like, okay, you still have diabetes, because obviously they're managing with medication, but it's normal. So I'm thinking to myself, like, what is normal? Because if you really think about it, if it got normal, or if their body got normal, they should not be taking any more medications. But they're still taking the medication. So how would you refer something as a normal? Like, to me, a normal healthy individual is who has no signs or symptom, optimal well-being, able to do anything and everything, healthy physically, mentally, emotionally, definitely not taking any medication. So if you're taking medication and your blood sugars are normal, that doesn't mean you're normal. You still have diabetes, if that makes sense. Obviously, they're referring it to as normal, but one of the things you got to understand is when you refer it to normal, when they keep referring to normal diabetes, or especially when your doctor keeps telling, like, hey, you're taking medications, your diabetes is normal. Every 6 months you go back, they're saying, hey, your blood sugars, everything is back. They're in great numbers, because they're looking at numbers. They're not looking at your overall holistic health. But they keep saying, you're taking medications. As long as you're taking medications, your diabetes will be normal. But one thing you got to understand, the reason, and we're talking about type 2 diabetes, the reason you have type 2 diabetes is the insulin resistance. So meaning by taking medications, you're lowering your blood sugar levels, which is great. They're being balanced. But the resistance to insulin, meaning your cells binding to insulin, is still there, where they cannot bind properly like they were before you had diabetes. So therefore, your levels of insulin keeps staying high in your bloodstreams. Now, there has been tons of studies, research, everything you call it. You could Google it up, look it up, research it. But high levels of insulin are what causes these side effects or complications that arise from diabetes, such as blindness, dementia, kidney failure, nerve pains, did I mention heart disease, high cholesterol levels. Even cancer has been related to high insulin level in your bloodstreams, and certain types of cancers. But when you have that elevated, because, hey, you're taking your medications, your blood sugars are normal, and you're doing everything your doctor's been telling you, and again, with medications, your blood sugars are definitely back where they should be, and they're referring to you as, oh, you have diabetes, but it's normal diabetes. But without you understanding, or even for that matter, your doctor understanding that, hey, yes, your blood sugars are normal, but the insulin resistance is still there. And that present insulin resistance will continuously to cause your body to deteriorate, because high elevated insulin level is not good for your health. They will cause, like I said, all the complications that arise from diabetes. So you could have so-called normal diabetes for 5, 10, 20, 30 years now. For 30 years, every 6 months you go back and you've been referred to as, oh, you're normal diabetic. But even then, your chances of getting the complications, such as heart disease, high cholesterol, blindness, kidney failure, dementia, all those keep going up and up and up, because the insulin resistance is still present, because your body still has elevated insulin levels. So, you should be thinking about how, when I say how, you should be thinking about bringing your insulin resistance down, not just manage your blood sugars. Yeah, managing blood sugar is one part of it. That's a number they look at when we're checking for blood sugars. But it's about the insulin resistance that needs to be brought down. Because if you're just managed with medication and getting that term called so-called normal diabetes, you're going to the same path. Now, it might take longer than somebody who doesn't manage well, or somebody who has crazy blood sugar numbers for 5-10 years, compared to somebody who has managed it well with medications where the blood sugars are not completely out of whack, but the chances of you still getting those complications that are related to diabetes are still present. So you need to kind of think about it, because there is no such a thing as a normal diabetes. Either you're diabetic or you're not a diabetic. It's almost like, think it's like, oh, you have cancer, but it's normal cancer, meaning it's not killing you. We're going to wait till it starts killing you. Think about it. Like if somebody told you you had cancer, what would you do? You would do everything to get that fixed, get it out of your body, for that matter. You don't wait till it's like, oh, it's cancer, but it's normal cancer. It's not killing you right now. Well, same thing with diabetes. I mean, diabetes is not as aggressive as cancer in initial phases, but eventually it leads to kind of the diseases or the complications that end up taking your lives. So there is no such a thing as normal diabetes. Either you have a diabetes or you don't have it, just like either you have a cancer or you don't have a cancer. So think about it, because if you kind of just take that whole thinking or that whole terminology saying, or to make yourself feel better, in simple words. Somebody might not want to hear this, but this is the truth. If you're trying to just, by hearing that normal diabetes term, make you feel better, and you think, oh, you're in control of your health, I want you to think about it. Think about it again, because is there such a thing as normal diabetes? There is no such a thing as normal diabetes. To think about it. So if this made sense, if you loved what I had to share, please comment, like, share with anybody who could benefit from this. And we'll be doing this more often, talking about different health topics and kind of helping people make the shifts. Because a lot of times we're just stuck on certain things that we cannot get over. So we have to make those, I like to call them mind shifts or lifestyle shifts or whatever kind of shifts. We have to make the shifts to take our health to the next level. Because if you kind of start making yourselves feel better by hearing some terms such as normal diabetes or normal cancer or whatever that may be, it's not good. Because if they're saying it's normal, that means it's just a matter of time it's not normal and ends up taking your life or destroying your health and taking away the things you love to do. So please share, comment, like, and please continue looking out for our more videos that will be coming up soon. Thanks. Great. Have a good rest of the day.